Well, good morning, everyone. Thank you for being with us for today's Howard L. Boast Memorial Health Policy Forum. And welcome to our session, Making the Case for Funding, Education, and Beyond. I am Mark Neikirk, the director of the Scripps Howard Center for Civic Engagement at Northern Kentucky University, and I'm a member of the Foundation's Community Advisory Council and your moderator today. The late Howard Boast, in case you didn't know, was a health economist who was among the founders of UK's Chandler Medical Center in the 1950s. His lifelong mission was to assure quality health care to the Commonwealth and the nation. And with this forum, his work continues. Each year, the forum takes on a theme that is a focus as we try to think together about how we can work together to make our Commonwealth a healthier place with healthier people. And this year, we want to zero in on a factor that may not turn up on the list of obvious determinants of good health. We all know we can improve health outcomes by lifestyle changes like diet and exercises, or changing our habits, not smoking, wearing seat belts, drinking less alcohol. But we can make a tremendous difference in public health by investing in public education. That's what we're going to look at this morning with some guests who know this landscape very well. Our premise is this: education is a determinant of health. It is associated with life expectancy and healthy behaviors. Additionally, educational attainment plays an important role in shaping opportunities, employment, and income potential, and those in turn impact health. Our panel today will provide a look at Kentucky's school funding model, but also its potential to build capacity within the community to address education as a determinant of health. You will hear how Kentucky school districts are operating at their current funding levels, their needs, and some creative solutions they have come up with to fill those gaps. One of our guests this morning is from StriveTogether, an organization headquartered near me in Cincinnati, and one that I'm familiar with for probably 20 years or more because of its impactful work. It's an organization that brought national notice to a strategy known as collective impact. I hope I'm not butchering this powerful concept by oversimplifying it, but collective impact involves agreeing on something you want to change, how you want to change it, and how the many stakeholders working together, each with their own expertise and talents, can bring that change about. Keep that in mind as you listen today. What you bring to this effort, what do you bring, what can you bring to this effort to invest in education so that every child might succeed and lead a healthier life? As a reminder, before we get started, if you have a question, please type it into the Q&A function at the bottom of your screen. We'll field the questions at the end of the session. Thank you, and let's get started. Our first speaker, Pam Thomas. Pam is actually going to join us with a pre-recorded remarks, but her colleague, Ashley Spalding, is with us this morning, will be available for the Q&A session. Pam is a senior fellow at the Kentucky Center for Economic Policy. She joined the staff in 2017 after a career in state government. And prior to joining Kentucky Policy, Pam was a committee staff administrator for Appropriations and Revenue Committee of the Kentucky General Assembly. She has extensive experience in the areas of tax policy, budgeting, education, finance, and workforce policy. She also spent some time with the State Justice Cabinet with a focus on juvenile justice policy development, budgeting, and strategic planning. Pam has a law degree from the University of Kentucky, a BS in business from St. Bonaventure University in New York. So let's hear from Pam. Bear with us, everybody. You can't have technology without having a glitch. That's kind of the rule, but we'll figure it out in less time than it would take to drive to Louisville.
For the sake of timing, do we mind adjusting our order a little bit, and we'll kick it to Collin first?
That's fine, yes. Okay, we're going to go to Collin. I hope ready to go. So Collin Groth is the Executive Vice President of Strategy and Development at StriveTogether, where he provides leadership and strategy for StriveTogether's programmatic work, including impact advancement, learning, and evaluation for the Cradle to Career Network. The son of a public librarian, Collin has always been passionate about the improvement of educational outcomes for all young people. And before joining StriveTogether, Collin served as the Government Relations Director for Southwest Ohio Regional Transit Authority. He holds a Bachelor's of Arts in Communication from The Ohio State University, and he was an Eagle Scout, Troop 502.
Well, thanks, Mark, and great to be with you all virtually. Mark probably knows this, but for those that are outside of Cincinnati, where I'm based, we had an amazing 4-day arts festival over the weekend. So you're catching me. We'll see how my voice holds up, because I was out and about enjoying all the scenery as we had this incredible Blink festival going on. But I'm going to share my screen here in a minute. Let me make sure I've got this right. Hopefully you can see that. So just first, by way of introduction, so my name is Collin Groth, as Mark mentioned. I'm the Executive Vice President of Strategy and Development here at StriveTogether. I'll talk a little bit about StriveTogether and our kind of history and origin, but you probably heard my prior role was actually Government Relations Director at the Southwest Ohio Regional Transit Authority. Sometimes people are like, well, if we're talking about social determinants of health and we're talking about educational outcomes, why in the world is somebody that's coming from a transit system talking to me today? So I like to joke, Mark mentioned in my bio, my mother was a public school librarian. She was a K-2 librarian for a primary school here in Cincinnati. And my father was an electrical engineer. So I like to joke that I sort of was destined to be thinking about how education systems have been engineered and created over time. But I think that connects to this conversation, right? So StriveTogether, for those that don't know, let me see if I can advance my slides, started out of a conversation that looked something like this. And I'm sure this conversation has never happened in any of your communities. This is actually from the Albuquerque Journal, as our partnership called Mission Graduate in Albuquerque, New Mexico was getting started. But they were having a conversation that looked a little bit like this in the community, right? It was like, the business leaders saying we need better educated high school grads. The colleges saying, we need better high school grads. The high school folks saying, well, we need people more proficient in math in middle school, right? So we had a very similar conversation happening in Cincinnati way back in 2006, right? And so Mark's been around this work for a long time. We had an incredible group of leaders in Cincinnati around that time, including Jim Vitruba, who had been the president at the Northern Kentucky University, Nancy Zimpher, who was president at University of Cincinnati, Father Graham from Xavier University. And if you know Cincinnati at all, I talked about Blink in this Arts and Culture Festival, but Cincinnati, we're almost spoiled in the sense that we have an incredible wealth of kind of corporate leaders in the corporate community that really kind of outkicks its coverage for a city of our size. We have more Fortune 500s in Cincinnati than Boston, right? So you got Kroger and Procter & Gamble and all these big companies. And a very similar version of this conversation was happening in our community at the time. We were talking a ton about talent. And for anybody that was, doing change work around that time, you had books like Tom Friedman's The World is Flat had come out. Richard Florida and folks were talking about the creative class and the importance of recruiting and retaining young professionals. And so a conversation similar to this cartoon was happening in Cincinnati, where leaders across our community were saying, we need this better educated workforce. We need, if we're going to recruit and retain young professionals, if we're going to keep these these corporate partners in Cincinnati. Oh, I see our folks having audio issues. Can you hear me? Patricia, can you hear me? Yeah, okay. I'm just going to keep going then. So we had this conversation happening about, how do we create this talent pipeline, this workforce of the future? And when we started to do our factor analysis, right, and start to think about what some of the challenges were in creating that talent pipeline, we started to look back and say, well, what does the data tell us about where there's a sort of need or a pinch point. And what we were finding in Cincinnati was, we really needed to get more kids graduating high school, career ready, and on a pathway to some kind of post-secondary success. And so we did what a lot of folks tend to do in the nonprofit and education space was we were going to start a new program, right? I'll say it again. We were going to start a new program. We said, well, if we need more kids to get into college, then let's start a college access program. At the time, there was this amazing work happening in Kalamazoo, Michigan, called the Kalamazoo Promise that many people might have heard of. And the idea was basically, let's raise a big endowed scholarship fund. And every kid that graduates from Kalamazoo public schools with a certain GPA, we'll give them a scholarship so that they can have sort of that last dollar funds to go to college. And so actually, we don't talk about this much, but the original name of the Strive partnership was the College Access and Success Partnership. So we were kicking around this idea. Let's, leverage these corporate partners. Let's raise a bunch of money. Let's create this scholarship fund. And it was actually, we had this kind of, leadership table being formed around town. And one of the really important leaders in the community was a guy named Dr. Odell Owens, who some folks might have heard of. He was just named one of the greatest living Cincinnatians. And Odell's story is a really interesting one. He's sort of cradle to grave. He was involved both in the research of the first test tube baby, but also he was the county coroner. And so we joke that he was kind of a cradle to grave leader. But he, as the coroner, stood up in one of these early meetings and he said, look, we are program rich and we are system poor as a community. And as long as we keep looking for some silver bullet program, not only are we not going to graduate more kids from college, but I'm going to have dead kids on my table. And it was a shocking and sobering statement, right, in a lot of ways. And for folks at the table, they had to take a step back and say, well, what would it look like to be system rich, right? What if we didn't think just in terms of creating some silver bullet program where we, somehow now expect if we just hand this superintendent a new program, somehow stuff's going to get better. How do we actually think about the contributions that all of us are making to whether or not kids are successful from cradle to career? And we had in our community, great leadership. Folks like General Electric was sitting there at the table. They have this process called Six Sigma, this change process. And they were like, well, let's start measuring some outcomes, right? How could we know whether or not our system was getting better? Well, let's look at some population level data. And so we all started to look at things like kindergarten readiness, and not just say that's the responsibility of schools, but to say all of us play a role in that. And let's all start to look at early grade reading proficiency. And let's look at post-secondary enrollment rates, right? And even then we had business leaders starting to say, well, wait a minute, Rosa Blackwell at the time was the school superintendent, and they were like, Rosa, we're not seeing these great graduation rates. And Nancy Zimpher, the president at the University of Cincinnati, stood up and said, look, my institution prepares the majority of the teachers for Cincinnati public schools. And so as much as you want to point the finger at Rosa and the school system, I have a huge role to play in this because I'm doing the teacher preparedness work. And other leaders were looking around the table saying, well, wait a minute, the system I worked for, the transit system, we had never once had a conversation about what role we could play in supporting young people to get access to suburban job opportunities, right? So if anybody's ever been to Kings Island used to fly in kids from Europe, house them at the dorms of the University of Cincinnati, pay for private buses to take those kids out to Kings Island when we had hundreds, if not thousands of kids in Avondale and Bond Hill and Roselawn that would love to have that kind of a meaningful work experience. So all around the community, we started to have a conversation and people started to say, what can I do? Rather than pointing the finger, right, in the way that we see this cartoon, what can I do? What can my system do to contribute to better outcomes from cradle to career? And so from that idea, we started to see, and as a community, we were tracking these indicators of success. We started to see 93% of the indicators that we tracked starting to trend in the right direction, right? And you started to have community foundations changing the outcomes that they funded. You started to see transit systems like ours start to use federal funds to realign bus service using job access reverse commute dollars. So we all started to have a different conversation about what were the things that we could do to contribute to, in our case, educational outcomes. So from that conversation, we started to get Mark reference this collective impact article in 2011. Many folks might have read this article by folks from FSG. FSG had been in town to help a group called the Hale Foundation create a sort of a philanthropic strategy for their family foundation. And in their interviews and conversations around Cincinnati, they started to hear all these different stories, right? All these different change efforts that were happening. And they said, we think this idea is something called collective impact. And so they wrote this article. They highlighted the work of the Strive Partnership. This is not a term that we came up with. It was kind of written about us, not by us. But we started to get calls from all over the country, right, of communities that started to say, hey, we want to do that kind of work. How do we create that kind of a partnership? And many of those communities don't just come at it from a talent perspective, although certainly a talent perspective is one. I was just talking the other week to folks in the Lehigh Valley in Pennsylvania, Allentown and Bethlehem. They are like, we are thinking about social determinants of health. We're pretty sure third grade reading and whether kids can read by grade level in third grade, we're pretty sure that's a pretty strong indicator of long-term health outcomes. So we want to do this kind of work because we see it as a path to health. Other communities, they literally call their partnership a career to cradle partnership. So we see communities coming at this from many different perspectives, but what's important is this movement, right? StriveTogether, we talk about it being a movement of communities who believe race, place, ethnicity, and income shouldn't predict a child's future. And all too often in this country, that's exactly what happens. And so the network has now grown to 70 partnerships in 30 states plus the District of Columbia. The network supports about nearly 15 million children, nearly 9 million children of color. And what kind of unites us, right, is that idea. And if you're really like a process nerd, I would encourage you to go to our website to check out our theory of action. But what's been really amazing is the network over time has developed this framework. So we're on version 5 of our StriveTogether theory of action. And what it essentially lays out is that there's a process that communities can go through to actually organize around a shared set of goals and to use data to drive improvement on those goals, right? And so there's stages of development, right? In the Exploring Gateway, you're maybe crafting that vision that folks can rally around. You're selecting the outcomes and indicators that you might want to move over time, whether those be health, education, whatever kind of a change you're trying to make. In the Emerging Gateway, right, it's starting to disaggregate those data. It's starting to, we talked a lot about community capacity as one of the important things that we want to get at in this session. It's this idea of developing a backbone team, right? A team that is outside the school system, that is dedicated solely to thinking about the health of our systems, bringing partners together, facilitating conversations, using data to inform how all of us as a community can change our behaviors in ways that get to better outcomes. So this idea that you can actually follow a process, right? Not a program, but a process for how you set goals, how you look at your actions, how you use disaggregated data by race, by gender, by zip code to actually think about what services and supports are helping children right now. What are the bright spots? What are the opportunities? And for us, a big recognition, right, was so many folks around the country now are talking about this idea, not just of systems change, but systems transformation. And so what do we mean by that, right? We have a big partner here in Cincinnati with Cincinnati Children's Hospital. They're a preeminent global leader in how to do continuous quality improvement. And one of the first things I remember Dr. Uta Kodagal telling me when we were thinking about systemic changes, she said, well, I think systems change when policies and job descriptions change. And that was really powerful for me, right? And then as we've dug more into it, right, what we've also learned is that systems change when power changes, right? We've seen amazing school systems like in Menominee Falls, Wisconsin, where kids are setting their own goals every 2 weeks. They're testing strategies that they've identified, and they're giving teachers feedback on what helps them learn. They're empowered to really, control their own destiny in the learning experience. We've seen in communities like San Antonio, where young people are actually identifying the policy shifts that legislators need to be making and saying, hey, based on our experience, we really need supports around exclusionary discipline, and we need to reduce bullying because this kind of digital age is creating a pretty toxic culture for young people. But the folks that are most impacted by the work have to be empowered. And what we see is by making those systemic changes, we actually see improvement in cradle to career outcomes, which for us is the best interim indicator of whether or not kids are on a pathway to economic mobility. So, does this work? Does this kind of a collective impact approach work? Well, this is pre-pandemic data, but you can see here the number of partnerships that were actually improving specific outcomes, right? So this probably won't surprise folks because high school graduation rates can get a little fuzzy, but 54 of the 70 partnerships were moving high school graduation before COVID. 34 of them were showing a racial disparity gap closing. You can see 43 communities moving middle grade math, right? So based on what the communities were identifying, they were prioritizing these outcomes. And what we were seeing pre-pandemic is that we were seeing improvement by taking this kind of a systematic approach. Now we'll see how, what these data look like as we come out of pandemic and our outcome and assessment platforms are coming back online. But there's real evidence that, setting these shared goals, working together, creating a backbone infrastructure, somebody that's waking up every day thinking about how are we getting better on these outcomes actually leads to improvement. So, what does this look like in a community, right? There's folks, local stakeholders need to be providing services to youth, need to be working in collaboration to actually advance equity. You need to be identifying those policy and practice changes to mobilize action. You have to be shifting resources, right? Foundations, philanthropy, public dollars. How do we actually invest in what works? If you've ever read Moneyball for Government, less than 1% of federal spending meets the minimum requirements of evidence that we would qualify in the nonprofit sector. Less than 1%, right? So how are we actually codifying what works, not just into practices, but into resource flows? So let's just talk about a couple quick examples, in my last few minutes here. So Tulsa, Impact Tulsa is a partnership in Tulsa, Oklahoma. Before we could even start to think about things in the pandemic, like professional development for teachers or curriculum or classroom ratios, what they were learning, right, was that there was a massive digital divide that was happening. We saw this in every community around the country, right? Broadband, laptop access. We had not, as a society, been prepared for a massive disruption in in-person learning. So Impact Tulsa started to map, right, data around opportunity neighborhoods. They started to understand what was happening with evictions, what was happening with broadband, what were they seeing in terms of online participation, in-person learning, picking up of educational packets. They were able to provide those data back to community partners, right, who could go out and work with internet service providers to get broadband to families, to Boys and Girls Club, Big Brothers, Big Sisters, work with all these nonprofit providers who had relationships with families to go out and find the kids that weren't picking up the in-person learning packets. They were able to kind of mobilize as a community and actually leverage about $5.3 million in CARES Act funding to make sure that every child had broadband access citywide, right? So by having this kind of an infrastructure, by thinking intentionally as a community, by having a data system that allowed them to track individual student access and opportunity, they were able to galvanize in that moment to make sure that kids weren't left behind. E3 Alliance, this is a powerful story of, this is a within a school system example, right? So one of the predictive indicators that we see for post-secondary success is algebraic proficiency, typically by 9th grade. What E3 Alliance, they did a 7-year research analysis, right? Texas has a longitudinal data system. What they were able to see is that African-American and Hispanic and Latino young people that were rated as advanced for mathematics all too often weren't getting recommended or placed into advanced algebra, right? So even though they showed the same level of competence and proficiency, for whatever reason, whether it was the family's knowledge, whether it was the teacher's recommendation, those kids weren't ending up in the advanced mathematics courses. So they actually changed the school district policy. They worked with a group of the math curriculum specialists from across a number of districts across Central Texas. They worked with the universities to help with the analysis. They worked with young people to understand their experiences. And they changed the enrollment policy to be an automatic opt-in, right? So you actually had to opt out of advanced mathematics if you demonstrated proficiency. They've now closed the racial gap in algebraic completion by 85% over the last 3 years. by taking this kind of a data-driven analysis, by galvanizing partners across the community, they're seeing huge improvements. And by the way, those improvements for specific populations are also increasing their overall proficiency for mathematics because more kids are getting to that benchmark. For folks that may know the Cincinnati story, and I was involved for many years on the board of a group called the Emmanuel Center here in Cincinnati. Emmanuel Center was the oldest licensed daycare in the state of Ohio. We were a teeny tiny pre-K provider, right? We just had 24 kids in our program, and we thought we were amazing, right? We were doing pre and post assessments every year. We saw growth in our kids. It wasn't until the development of the Strive partnership where we first started to get data back through our early childhood collaborative Success by 6 and how our kids did when they actually got to Cincinnati public schools, right? So not just our program pre and post assessment, but for the first time, we got their fall kindergarten readiness entry assessment data. And what we learned was that we had a big difference between our two classrooms, right? And so we started to learn with some of the other providers around the community that having a particular early childhood credential for some of our teachers really mattered. Having a particular classroom size really mattered. And that was great, right? And we were doing that work for a number of years. But what we found as a community was that even if we got every single kid in every one of our pre-K programs to be ready for school, we'd only ever get to 52 to 54% of the kids because we literally did not have the slots in our community. We didn't have enough pre-K providers. So all the program improvement work in the world was never going to get us to every kid being ready for school. So what did we do? We started to work with business leaders, community leaders, the school system. We started to say, what would it look like if Cincinnati were to become one of the first communities in the country to have guaranteed high quality universal pre-K for every 3 and 4-year-old? And by the way, we had data that supported that voters would approve that on an income earnings tax at nearly 70%. So we were able to use that with the business community to say, hey, if you don't want to mess with this earnings tax, let's talk about strategies to get the business community to really invest in this change effort. There was an interfaith collaborative called the Amos Project that really started to organize religious leaders and others around the community saying that this was a moral imperative to get more and more kids into pre-K services. So Cincinnati passed universal pre-K funding that actually went through the school system, right? So it was a new property tax initiative, $47 million to public schools, about 16 million of that carved out for public pre-K. Included sliding scale scholarships to make sure even the lowest income families had access to this kind of service. We passed it with nearly 62% of the electorate, right? There were more than 2,000 house parties held in the community. We renewed that ballot initiative just a few years ago with nearly 70% of the electorate because the community had been galvanized around this shared idea, this shared goal. Norwalk Acts, for those that might be from a health system, is a great example. So Norwalk Acts is a partnership in Norwalk, Connecticut. If folks know the Ages and Stages questionnaire, it's a developmental screener, can be used at multiple age stages. What Norwalk started to do is say, we don't even have an idea as a community what it means to be developmentally on track, right? So they started to introduce and train all of the different providers, primary care physicians, right, pediatric offices, on this idea of the Ages and Stages questionnaire so that you could get a universal picture of a child's development from all the way from maternal health through their birth and all the way to attending school in kindergarten. And it was great, right? They started to be able to say, okay, this child we think is developmentally on track for motor skills, but needs to work on their literacy skills. They started to develop a shared language, and they had one measurement tool that they were using across this continuum. But what really accelerated their work was they started to find that parents and institutions had very different perceptions of how that child was doing on things like motor skills or literacy skills, right? And so they actually started to train parents to be able to do the ASQ themselves so that they could make an assessment and a determination of where their child was. They've now seen double-digit increases in school readiness and in huge increases in ASQ utilization because as a community, they've now galvanized around this vision. They've developed a shared language and they've looked at common data to drive improvement. The last thing I'll say, I know all of you are coming together across the state of Kentucky, right? So one of the common sort of false dichotomies that we've experienced, and we've seen it nowhere more powerfully than in the state of Kentucky, is this idea of the urban and rural divide, right? So I'm going to be a bit provocative here, and I'm going to tell you that I believe that race is a social construct that was created to divide primarily low-income communities and the working class. And that one of the most powerful ways to actually achieve racial equity is to work across urban and rural communities to drive policy change. Because, all too often we're like, oh, the needs of urban kids are very different from the needs of Appalachian or rural kids. Right. In the state of Texas, we had partnerships all across the state, including the Rio Grande Valley, Dallas, Houston, San Antonio. They worked together to do a data-driven analysis to look at the education state funding formula for the state, right? So you're going to hear a little bit about the Kentucky state funding for education here shortly. They fundamentally reworked the formula by working together to organize teachers, educators, low-income communities, urban communities, rural communities to come together and to say, we need to make serious investments in education. They did $6.5 billion in new money for public education. And importantly, it included set-asides additional funding for families experiencing multi-generational poverty, for English language learners, right? They also started to realize that while the specific programs in rural areas might need to look different than it did in urban communities, there was still important incentives that need to be put in place for things like post-secondary success. In the state of Kentucky, we worked with a partnership across Save the Children, the Urban League of Louisville, and Partners for Rural Impact, the artist formerly known as Partners for Education in Berea, Kentucky, where the folks from Berea and the folks from Louisville showed up to the State House together to advocate for investments in early childhood education, right? And when that coalition of, a Black-led urban nonprofit with a white-led Eastern Kentucky Appalachian community coming together to say, we collectively need investment in the early childhood space, that's a powerful coalition to drive change, right? So don't let these false divides keep you from working together across a state to advocate for the kinds of systemic changes that you think are necessary and possible. To that end, specifically to this idea of social determinants of health, we had primarily been tracking these student level outcome data. And as we've worked with our network's racial and ethnic equity action team over the last 5-6 years now, one of the things that they told us was really critically important was we have to also be looking at outcomes or indicators of our system's health, right? And so things like equitable school funding, you're going to hear about that in the video. Things like housing stability, right? So I talked about Tulsa. They're looking at evictions when they're thinking about third grade reading. Things like exclusionary discipline practices, right? So a community like San Antonio, they've worked to build restorative practices across Bexar County, right? And to move from this culture of punishment to one of healing. And then one that I know is so critical in Kentucky right now is food security, particularly after some of the natural disasters that we've experienced. So you can't do these things in isolation. You can't just say, well, what's the third grade reading assessment say? You have to look at indicators of whether or not our systems are behaving in equitable ways. So I think I'll leave it there and just with this image say, the idea here is how do you all come together across systems to put youth and families at the center? I look forward to questions a little bit later today, and thank you for the time.
Thank you, Collin. And I'm just reminded as you were talking about the StriveTogether efforts, some of which is at the macro level of institutions of an early collaboration that involved just various agencies around the region that provided after-school services to kids. So you mentioned Six in which you are Six Sigma, in which you identify a particular need and a common goal. And so you began to have things like the Boys and Girls Club and other community centers say, we have after-school programs, we have slots available, or we don't, or we offer computer training and we offer maybe something, basketball skills. So how can you put all of these services in one place and begin out of increments to create a system of providing after-school services? And so that's the way it began to work in some smaller pieces. But I'm also reminded as you're talking that it's been 32 years ago, and if you back off to before the legislation was passed, even a little longer than that, Kentucky began to have a discussion around system change, particularly in school finance, that resulted in something much broader than just a school finance legislation, but comprehensive legislation called the Kentucky School Reform Act of 1990, which brought national attention. We have taken pieces of that out, and we in the years since, and we haven't had this same kind of conversation about system change in a long time. But we're going to go now to Pam Thomas from the Kentucky Center for Economic Policy's pre-recorded remarks, but I think it will take us logically into that, thinking about that piece in a big way. Where are we in terms of the funding model? What might we do? So I invite you all to remember what Collin said about system change as we look at where we're at in the funding model.
Good morning. I'm honored to be a part of this panel examining and connecting health and education. And I'm sorry I can't be with you live this morning. I've pre-recorded my presentation, and my colleague Ashley Spalding will be available later to answer any questions that you may have following the presentations by the other panelists. And so I'm going to start things off today by providing a brief overview of education funding in Kentucky, how the Support Education Excellence in Kentucky, commonly referred to as the SEEK formula, works, how it's funded, and what's happened since CARA was passed in 1991 to the funding streams for education. I'm also going to talk about other areas in the education budget that are funded by the General Assembly and that help to support teachers, schools, and families outside of the SEEK formula, and how those funding streams have fared over the past several years. And finally, I'm going to connect all of this to how taxes and revenues play a vital role in ensuring that we adequately support education. This conversation is especially important right now for a couple of reasons. I'm sure that a lot of you are aware or have heard that in the two most recent legislative sessions, there has been a surplus of revenues, and that's very unusual. Revenues have far exceeded the estimates, leaving the General Assembly with historic budget surpluses, and strong revenues are projected for the current year that we're in. Now, the reason that we have all of this extra revenue really has to do with a couple of things. One is that we have had unprecedented federal money coming into our state through the different COVID relief programs. The school districts have received money, cities and counties have received money, individuals have received money, the state government has. And the effect of that is it's really propped up our economy and given people money to spend that have kept things going and kept our taxes robust. The other things that's keeping tax receipts pretty high right now are honestly inflation. Things cost more, and when things cost more, sales taxes go up, and more people are getting jobs and making more money, which has resulted in the individual income taxes going up. So up until 2 years ago, the legislature was operating in an environment where the needs were a lot larger than the available revenues. And despite that, even then, they were focused on cutting taxes rather than ensuring that we had the revenue base that we need that will sustain us over long term. And P-12 education is one of the largest areas, is actually the largest area of general fund expenditures in the budget. And so it suffered more than any other area. And I'm going to show you a slide on that in just a minute. I'm going to talk more about this later, but the legislature continues to appear to be moving forward with additional income tax cuts with a goal of completely eliminating the state income tax, which is currently our largest source of revenue. And the really scary thing about this is that it is not going to be possible to replace those revenues with other taxes. There just simply aren't enough other revenue sources out there, so that although at first glance, it may seem that this revenue situation we're in right now is wonderful, in reality, it's a little bit scary because it does seem to me that what's going to happen is the General Assembly is going to be primarily focused on cutting taxes and not on investing. So this slide shows in percentage terms how the general fund resources are allocated in the 2022-24 budget. And as you can see, P through 12 education is the largest component. It's interesting to note that in the last budget, P-12 education constituted 40% of total expenditures. What's shifted since then is the stockpiling of revenues in the rainy day fund, which is reflected in the other category here. So rather than using the money that they have to fund crucial needs, the General Assembly is instead stockpiling those revenues in the rainy day fund because their primary goal right now is cutting taxes. I'll come back to revenue later and why they're important, but for now, I'm going to shift to providing a pretty high-level overview of how education is funded and how funding has changed over the years. So in 1991, following the Kentucky Supreme Court decision finding that Kentucky's system of funding education was unconstitutional, both because it wasn't equitable, because some kids had a lot more resources than others based on the ability of their school district to raise revenues locally, and because the funding wasn't adequate overall. The General Assembly responded by resources than others based on the ability of their school district to raise revenues locally, and because the funding wasn't adequate overall. The General Assembly responded by increasing taxes to begin reinvesting in public schools, and at the same time, they established the SEEK formula to equalize funding among school districts, providing more state funds to districts that have less capacity to raise revenues locally because of their smaller tax bases. The funding and establishment of the SEEK formula put Kentucky on the forefront of education nationally, and for years, Kentucky was steadily improving in rankings in many areas. So now the slide that you see up here now is going to help me explain kind of an overview of how it all works. I think it's easier to understand if you can actually see it. So what I have here is a school district calculation sheet for Adair County, which I selected because it's the first page that appears when you open the document. And then the document for all the school districts for this year going forward and many, many, many years in the past is available on the KDE website. I have added the colors here to make our looking at it easier. You won't see the colors if you open the pages yourself. So I want to start by going to this gold arrow here in the middle of the page. Each budget established as a SEEK base guarantee for every student for each year. It's a base amount that every school district will receive for every student that they educate. This sheet is from the 21-22 school year, which shows that the base is $4,000, and you'll see that here in the light blue. The 2022-24 budget increased the base to $4,100 in 2023 and $4,200 in 2024. The base funding amount for each district is calculated by multiplying the per pupil funding amount, which is the $4,000, by the attendance in the school district, and that's this number right here. I'm going to talk about that a little bit more in just a minute. So the base guarantee, which is what this calculation is right here in the middle, is funded through a combination of state and local funds, with the state contributing more money to districts that have less property wealth and therefore less ability to raise revenues locally. In this way, the state funds equalize districts, bringing those that have less property wealth up to closer to those that have more. To participate in SEEK, school districts must levy what's known as an equivalent tax rate of at least 30 cents per $100 of property valuation. And so to do this, school districts can levy a variety of taxes, including property taxes, which they all do have to levy, and utility gross receipts taxes. You may have seen those taxes on your utility bills, and most of the districts levy those. And they can also levy occupational taxes. Only 8 of them do that. And they do have the ability to levy an income tax, but none of them do that. So all of these taxes they levy, the revenues from them are combined to come up with the equivalent rate. The SEEK formula also includes additional funds, which are referred to as add-ons. And on the slide up here, those are the ones that are in the green. And these are add-ons that take into account the fact that some students cost more to educate than others. The test of free and reduced lunch is used for children that are low income, students with disabilities, and there's several different factors that are taken into account in determining that. Students with limited English proficiency and home and hospital services. So the thing about these services is, yes, districts get, these funding provided to provide these services, that districts do get more money for it, but the formulas that determine how much more money they get have not been revised since 1991, when the formula was first created. And so with this broad overview, let's take a look at the details on this Adair County sheet. So here in the upper left-hand corner, highlighted in gold, you can see the total assessment base for the county of $868,424,806. So that's how much the property in the county is valued at, along with the estimated number of students that I pointed out earlier. Rounding up, it's 2,434, and that's an average over the entire prior school year. Now, moving back over here then to the middle of the page, you can see how the SEEK calculation actually happens. We talked about the guaranteed base already, that's here in blue, along with the amount per pupil for each of the special add-on categories, which is here in green. And then when you add those together, you get the calculated base funding, which is here in the red. Then what happens is that the amount that the local district is required to contribute, that's 30-cent equivalent, is deducted out, and that's right here in the orange. And that leaves the state portion of the formula amount for Adair County. I know that people sometimes think that if their school district raises taxes that they'll get less state money, but this isn't true. The state contribution is based on this calculation, which is the same for all school districts. And so anything the district levies above and beyond that required 30-cent isn't included in this formula. So you can see from this example that Adair County is a district that cannot raise a whole lot of revenue locally, so the district receives a significant state tax contribution. In addition to requiring a minimum tax levy for districts to receive funding, in the SEEK formula also includes some upper limits in an attempt to prevent wealthier districts from getting too far out ahead of districts with less capacity. So think about it as there's a lower limit and there's an upper limit, and the goal of it is to make sure that districts sort of stay in the same ballpark so that we don't get the inequities that we had in the past and that resulted in CARA. I'll talk more about this later, but for many reasons, the upper limits haven't really worked. The first additional tax levy a district can impose is called Tier 1, and you'll see the levy for Adair County highlighted here in purple. This is an additional levy they can impose up to 15% above the adjusted base. And if the county does, if the school district does that, the state will equalize it to 150% of the statewide average property value per pupil. So they take all of the assessments in the state, add it up, divide it by the number of pupils, and then they figure out 150% of that. So essentially districts with less property will get equalized. Districts that have a pretty high property tax base will not get equalized. And then in addition to Tier 1, which as I just said, is equalized, districts are also permitted to levy another tax, which is referred to as Tier 2. That's subject to voter approval, and they can go up to 30% above the SEEK base plus Tier 1. And so now, just as a means of comparison, I want to show you a district that has a pretty healthy tax base locally. And this is the same information you just saw for Adair County, but this is for Boone County. And I'm not going to go through the whole thing here, but what I want you to notice is the portion highlighted here in red. Unlike Adair County, which contributes $2.6 million from local funds, but receives $10.9 million in state funds, what this means is that 19% is local funding, and then in Boone County, 52% of the SEEK base is funded and locally generated. So that's what you can see right here. So the total base in Boone County, and then you see the 30-cent local effort. So you see that actually more money in Boone County is coming from the local effort and not from the state. And so now that we have talked about just in general how the formula works and covered the basis, I want to talk about what's happened over the years to SEEK funding overall with regard to the state and local contributions. The overall portion that the state pays on a per pupil basis through the formula has declined by $162 when we compare 2008 to 2024. Well, the local portion has grown by $540 over the same period. So what this illustrates is that the cost of the nominal increase in base funding is being borne primarily by local school districts. So what I just said, those numbers don't take inflation into account, and the slide that I'm showing you now does. So when we factor inflation in, as shown in this graph, the per pupil guarantee is lower in 2024 than it was in 2008 by $1,225 per student, which is a decline of 23%. And the state contribution is $1,334 per student lower than it was in 2008. Thus, despite the claims that the state support for education is increasing to historic levels, the amount the state is contributing to the SEEK-based formula has actually declined. So why does this happen? Well, it happens because the overall base guarantee hasn't increased very much, but the local property tax assessments have increased, which, and that's in part because property values just tend to go up over time. And what that's done is it's shifted more burden to the local school districts. And so if we look now at the base funding, that's what this slide is going to show. And you can see here that the trend line is down. Now, the 2024 budget did have some really good wins for education in it. For example, full-day kindergarten is fully funded during the biennium. However, as you can see in the graph, total state basic funding goes down from 2022. And that's, like I just mentioned on the last slide, we see increased property tax bases and declining student populations. But in inflation adjusted terms, state SEEK funding is 31% lower in 2024 than it was in 2028 before the Great Recession. And so then the next slide helps to get us now back to those inequities that I started talking about. What this graph shows is that over the years, the state revenue growth has failed to keep pace with the economy due primarily to session after session of new tax cuts, exemptions, and preferences, leaving us with a shortage of revenues, and the commitment to adequately and equitably fund P-12 education has faded, even as the base guarantee has increased over time. With the state support diminished and the burden shifting more to local districts, we're once again facing increasing inequities among the districts, almost at the level we were at when this funding was declared unconstitutional back in 1990. So if you look at the far left here, that's where the inequities were in 1990. And if you look at the far right, that's where they are today. So what this means is that in real terms, it's the students that live in districts with less capacity to raise local revenues are not receiving the same level of resources as students that live in districts with more capacity. And these inequities lead to a whole host of issues for these school districts that make it more and more difficult to provide what the children need. I'm going to note that this graph goes through 2021. The other ones I've been showing go through 2024. And so to finish out this part of the presentation, I want to just give you a graphic illustration of what it means for school districts that are essentially the same size but have different assessment bases, and what that means and how that translates into their ability to levy revenue and raise money to do the things that they need to do. So what this slide shows is I took 5 districts that have roughly the same amount of students, somewhere between 2,000 and 2,500, but they have very different assessment bases. You'll see the first 2 listed here, Bell and Estill counties, have fairly low assessment bases. Garrett County is kind of in the middle, and then Bourbon County and Bardstown Independent have higher assessment bases. And so what I'm attempting to show you here in this chart is if each of these districts increase their property taxes by 1 cent per $100, how much money would they raise? And what you can see if you look at the gold column is that with the exact same effort, Bell County will generate $55,000 and Bardstown Independent will generate $154,391. So what that means is that, let's say that all of these school districts need to renovate an elementary school, and it's going to cost roughly the same amount of money in all of the places. The taxes that they're going to have to levy in Bell County are going to be significantly higher, 66% higher than the taxes they're going to have to generate in Bardstown Independent to accomplish the same goal. And so this slide illustrates both why state equalization is necessary, and it also shows how the disparities among districts can and will increase when the state fails to invest, as it has over the last several years. Before I finish up this portion of my presentation, I do want to spend a little time talking about funding for schools outside of the SEEK formula, which includes things for after-school programs, friskies, professional development, and textbooks, and many other areas. The 2022-24 budget did include some increases for friskies, Family Resource and Youth Services Centers. It raised the amount from $184 per student to $210. And then there was $7.4 million included for mental health professionals in schools, and career and technical education got a huge increase with their appropriation almost doubling. However, on the other side of the equation, there was no added funding for preschool or extended school services, which are the programs that happen after school. And there continues to be absolutely no funding at all for professional development or textbooks and instructional materials, which has been the case for several years. So in summary, before I shift to the second part of my presentation, the 2022-24 budget was the best budget for P-12 education in many years, but it still fell far short of what is needed. And even though there's more money, the erosion will continue going forward if significant amounts are not invested. So I hope that was helpful to you and that you have a better sense of how the funding streams work and what has happened over time, shifting responsibility away from the state into local governments and how that's increased the inequities again among districts. And so to finish up, I'm going to talk and spend the last part of my presentation about past and future tax cuts and why they will really hurt the ability of the Commonwealth to invest in our future. The discussion around our budget typically focuses on how the state can't afford adequate investments in schools, child welfare, public health, libraries, and more. But the narrative often excludes the impact of proliferating tax breaks on what we can afford. Kentucky's general fund is currently much smaller as a share of the state economy than it's been even in the past, even with all of the growth that we've had in the past few years. If tax revenues had grown in step with the growth in our economy and the general fund were still the same size relative to personal income as it was in 1991, after the legislature raised revenue to help pay for CARA, the state would have $3.3 billion more in recurring revenues to invest in education, health, and other services. And why is this? Well, the primary reason our revenues haven't kept pace is because session after session, the General Assembly enacts more tax expenditures. So what are tax expenditures and why do they matter? Here's the definition included in the 22-24 expenditure analysis. And it's especially important to note the part that points out that tax expenditures are an increasingly larger part of the state government expenditures without the need for explicit reapproval or authorization by future legislators. So what that means in real terms for us when we think about it is that the tax expenditures reduce revenue and they don't require annual appropriations and they do not require the legislature to approve them once they're there. So they just reduce revenues from the beginning and they really are just like appropriations. So the 22-24 tax expenditure analysis, which is available on the State Budget Director's website, lists close to $19 billion, billion with a B, in tax expenditures over this biennium. This slide lists just a few that were passed during the 2021 session. Then in 2022, the General Assembly passed several pieces of legislation that reduced revenues even more. The most significant of which was House Bill 8, which over time seek to completely repeal the individual income tax. I mentioned this back at the beginning of the presentation. This is currently our largest source of revenue, the individual income tax. It makes up just under 40% of our general fund revenue. And the revenue loss from the most recent tax changes just enacted in the last session is expected to be between 800 and 900 million, based on an estimate from the State Budget Director's office. And so based on the definition on the last slide, what this means is that before the very first dollar is appropriated, slot machine operators, real estate developers, Hollywood production companies, and cryptocurrency miners get paid. For comparison, the $555 million spent over the biennium on just these tax breaks would pay for a 5% increase in K-12 per pupil base funding. So as we look and think about who currently pays taxes in Kentucky, it's clear that Kentuckians who have less pay more proportionately, as is illustrated in this slide. Our system has always been regressive, but it has been even more so in the past few years. And that's primarily because of the shift from the individual income tax to the sales tax, which is much more regressive. As we look and think about who currently pays taxes in Kentucky, it's clear that Kentuckians who have less pay proportionately more. And as I just noted, our system has always been regressive, but now it's even more so. This slide here illustrates what will happen when our income tax rate is reduced by 1 percentage point, which is getting ready to happen over the next year because of House Bill 8, as I mentioned previously. So one cut is already kind of baked in, and we're going to have it. It's going to take our individual income tax rate from 5% to 4.5% beginning in January of 2023. With that cut, we're going to lose an estimated $594 million from our general fund. Conditions have also been met for a further reduction from 4.5% to 4% if the General Assembly approves the cut during the next session. And if they do, we're going to have $1.1 billion less in annual revenues than we had before those cuts started. So as I noted previously, this revenue loss is huge and can't be made up with other resources. And it will disproportionately impact Kentuckians at the lower end of the income scale, as this slide illustrates. So everyone really doesn't benefit equally from income tax cuts. They disproportionately benefit the wealthy because the poorest Kentuckians don't pay income tax at all. If everyone under the poverty line in Kentucky does not pay income taxes at all. So with a cut to the income tax, they do not benefit. And they also suffer the most from the reduction in services that will be necessary to offset the cuts, while the wealthiest Kentuckians reap the largest benefits. But it has been even more so in the past few years, and that's primarily because of the shift from the individual income tax to the sales tax, which is much more regressive. As we look and think about who currently, and we're going to get started. And they also suffer the most from the reduction in services that will be necessary to offset the cuts, while the wealthiest Kentuckians reap the largest benefits. I want to make this connection between education funding and revenues in this presentation because I think sometimes there's a real disconnect and people don't often think of the two together. We want good schools, safe state-of-the-art buildings, and the supports for families and children we've come to rely on our public schools for, and that we've really noticed during the pandemic and specifically. But the message that taxes are bad and should be reduced is what we constantly hear. And when we hear these messages, they're disconnected from what we actually use tax revenues for. And they need to be connected. And this isn't just this case for school funding, but it's also for all of the funding that the state provides to help support our kids, families, our health and well-being. I'm going to close with the same cautionary words that I started with. We're in a precarious time from a funding standpoint. The austerity mindset has led to significant tax cuts year after year, and the promised trickle down as a result of the cuts has instead flowed back up, making those who are already wealthy even wealthier and causing those already struggling to make ends meet struggle even more. The lack of resources has resulted in underinvestment in all areas of state government, and we're now at a point that there are critical shortages and deficits that can't be addressed without significant investments. Yet we are still hearing that the plan includes more tax cuts. So I think that the other speakers that will be on this panel are going to provide a little bit more information for you about exactly how this all translates and plays out in real life and what this disinvestment in education has caused with regard to our communities and our health and our children. Thank you for having me today, and I hope that you enjoy the remainder of the panel and the conference.
All right, well, thank you. I know Pam can't hear us, but we, if somewhere in the spirit world go our thanks to Pam and Ashley. You can be the translator of our appreciation, and Ashley Spalding, Pam's colleague, will be with us here during the Q&A session. So just keep in mind what you've heard about sort of the macro picture of funding for public schools in our state. But we're going to go now to Patricia Sheffer, who can tell us what this looks like at the level of a single school district. Patricia is the superintendent of the Union Public Schools and has 29 years of service to public education. She's been an elementary school teacher, so she's been in the classroom as well as a principal and a curriculum specialist. As superintendent, she's been recognized as the 2021 KSAA Superintendent of the Year and is a 2015 Chamber of Commerce Community Leader of the Year, and a number of other awards that just speak to her excellence as a leader in public schools. She holds a Master's of Education from Murray State and is a graduate of the AASA Midwest National Superintendent's Program. And Patricia, I'll turn it over to you to talk to our attendees about what this looks like. You have to operate with what you have and also try to be visionary at the same time. How's that work out?
Quite interesting, Mark. So thank you for asking me to join this morning. It's been good conversation thus far. So I just wanted to share, I have some talking points here for the viewers to look at. We all know public ed, we've definitely experienced challenges prior to COVID. So I've listed a couple of those factors here that we have to consider as leaders of the district. The first thing is teacher shortage. We all know we've been working really hard to recruit and retain teachers prior to COVID, and then COVID's just exacerbated all the issues we have in public ed. And so I think now more than ever, we have to also add the respect part. So when we're looking at recruiting and retaining and respecting staff, that has to be the key word as we move forward. We have several teachers who have been working with us on alternate certification, but as it was mentioned before by Pam and Collin, there are no PD money dollars now. So when you look at bringing in alternate certified teachers, they have the content knowledge. They might have been a president of a bank, and have the math degree, but they don't have that teaching pedagogy of how you deliver that instruction with the most research-based instructional practices. And with the state not providing professional development money, it's really hard for that training. So again, that consumes more time with our current staff to help provide the training that's needed and necessary. So I think that's one piece that we have to look at even before COVID. Like I said, that was an issue, but moving forward, we're going to need professional development fund if we're ever going to get to the level that's expected of us. That funding was actually eliminated in 2019, and we haven't received any of those funding since. In 2017 was actually the last year of funding for our instructional resources. So there are many times that teachers will provide for themselves of what the state or the district can't afford to provide. You hear teachers all the time saying this is what we need for our classroom. And locally, we have provided $100 per year for teacher supplies. And now with inflation of materials, that doesn't begin to cover the need that they have within their classroom. So again, there's additional dollars needed for that. And then, also local districts, we have provided nurses in every school for our students. The needs now are so much more greater than they have been in the past. Years ago, you might have thought of a nurse being in the school to help pass out medicine or take temperatures or things like that. Now we have some more severe needs of students with, GI tubes, colostomies, lots of different things that take place. So we educate students regardless of what their needs might be. But again, there's no funding for that from the state level. Transportation costs, that has been an issue we've dealt with for years. We've always said, if our state legislators could fund transportation fully at 100% and codify kindergarten and pay that 100%, that would help us meet the basic operational needs in our districts, but that's yet to be done. We're very excited about the money that has gone into public ed, is like what Pam said. In transportation, they have increased that this year from like 59%. I think we're up to almost 62% being funded. And then when you consider things like our diesel costs this year, we talked about the inflation of that. That has increased that's increased, I think it was like 37% more as far as diesel. And then when you look at kindergarten, this year they did fund full day kindergarten, but we also know it's still not codified. And so when you consider it costing us like $369,000 a year, we can't play with those dollars. If there's a lot of factors that go into teacher raises and things like that. And one of the things the legislators have mentioned this year was, well, we provided full day kindergarten, and increased your transportation and added $100 to SEEK. So now you all can provide an 8%, you provide it yourself, the 8% raise that all these other public service entities received. But you have to remember, when you're working here with your budget year to year, not knowing what those shortfalls might be, until kindergarten is fully codified, we cannot count on those dollars. So that's one of the things we want to keep pushing with our legislators to understand that needs to be codified for us to have a little more stability with our budgets, and that's not happened yet. So we're going to continue to work on that with our legislators. Another issue is safety within our schools. You know, Mark, when we were in school, we didn't have to worry about school shootings as much, or the drug issue, or social media. Social media has really changed education atmosphere and environment. And so, you know, when you look at cyberbullying, some of that's coming into the schools, that really takes effect on our students. And it was pre-COVID, but after COVID, again, it seems like that's exacerbated the problem because students were home, parents were home, they were on these devices 24/7, and we are seeing the outcome of that behavior now within the schools. So we know the intent with the legislators was good when they said they wanted to make sure that every school had an SRO in their schools before the school year started this year. However, we also know there are barriers that will not allow that to happen. One, I think they were intending that the municipalities would help, you know, our school systems, but our local law officers and agencies, they're short-staffed too. So there's a shortage issue there because across the state at one time, the number was like we needed 620 SROs in our state, but we only had like 235 trained and ready. So when you look at the funding piece for training not being provided, that's an unfunded mandate. It's not provided, and also just the staff availability is not there. So those issues, again, were pre-COVID, but now we even have a bigger problem with that. So we will continue to work on that. But I think, you know, we've always said I'm a very transparent superintendent. I believe in you have to have a good, strong foundation with loyalty and trust, and any great organization is built on trust. So I think it's always good to be transparent and share the good, bad, and ugly. And I think when we look at the pandemic, especially the academics, we all know when these test scores come out, I'm sure they're going to be disappointing, but not surprising at all. Because when we were going through our pandemic, we sat down and said, what are our priorities right now? They look a little different. We're starting into a pandemic. We have no idea what we're dealing with. No one does. This is a new virus going through. And so, you know, everybody hits that chaotic moment and you have to try to get in control. And so we sat down and said, what are our priorities right now? And our first priority was health of all, to make sure that we kept our students and staff healthy, and then safety of all. After, like I said, there's a lot of issues just in society, the ills of society right now. We know there's lots of issues going on with that. So the safety of our students was second. And then most importantly, that is usually in the forefront, is our education of all, but that had to take a back burner during the pandemic. And we provided that the best way we could. But again, our priority was health of all for our students and their family. And we had a lot of, you know, students and families and our staff that dealt with the loss of loved ones. So I think at times people, when the pandemic was going on, they forgot about the people providing public health services, whether it was at the school level or at the hospital. They too were dealing with the pandemic and loss and grieving. But at times I think people forgot that. So the struggles are real. We knew the struggles were real when we were going through it. But through the struggles, I feel like, you know, we have to stay focused on the positive, and we become stronger through those struggles. But moving from that surviving mode from COVID through to thriving now, that's going to require adequate funding. Like Pam said, our legislators have been working on that, but we're still not to that level where we need to meet the needs of all of our students. So again, we're very thankful for the investment our legislators made for public ed this year, but we must continue to dig deeper in the state funds to meet the goal of at least the equivalency of where we were funded in 2008. I serve on several different councils, one being the Council for Better Education. And right now the focus with that is the House Bill 563, because we should never divert public dollars to private education. In public education, our forefathers years ago said, you know, we're to provide a common school, and public education is that great equalizer. We educate all students regardless of their zip code, like Collin had talked about, or their socioeconomic status. We're here for each and every student, and we would never counsel like our guidance counselors might counsel them out at a charter school and say, this school might not be the best for you, might want to go back to public ed. So we know there's a lot of factors embedded within House Bill 563. So I'm very proud to say I serve now as the secretary of that council, and I'm very proud of the work that's going on in that lawsuit right now at this Supreme Court. I'm also a board member of our Kentucky Association of School Superintendents, and we continue to work on our legislative agendas each and every year. And I serve as one of the 2 Kentucky reps on our AASA governing board. And the reason I'm working on that really hard is to continue the work and advocacy on the federal level for adequate and equitable funding. Pam talked a little bit about adequate funding, but equitable is also the other issue. When you look at those districts, like she said, some have more assessment in their districts and others don't. And when you come from a small rural district, I'll share more later of what that looks like and how it's transpired into our local individuals paying more than what the state pays for our education here for our students. So if you would, I'll go ahead to the next slide and I'll start talking about some of the recovering efforts from the pandemic. But most importantly, I want to highlight our community partnerships too. I really feel like Collin had talked about, empowering others, and we've empowered others through our strategic plan. Back in 2016, we started asking our community about what is it that we want our students to know and be able to do, but most importantly, be like. And from that strategic plan, we worked with all of our community members through a lot of our different civic organization and our economic development. We were asking, what is it you want our Union County students to be like to make them employable? We came up with the 3 pillars of, our college success, life success, and career success. But most importantly, everybody wanted to focus on inspiring our students to become well-rounded individual and focusing on the connectedness of everybody feeling that sense of belonging and things like that, and productivity and adaptability. Those were the things that we heard more than anything is, we need our students and our employers, our employees to come to work and be ready to work and give 110%. But attendance was key. And so we really focused on our life success pillar a lot. And then we created our district goals, and they're on a district scorecard that we can progress monitor every 45 days with our schools. And our district goals cascade down to our school goals into those SMART goals, so we can really measure what's taking place in our schools each month. So just to highlight a few of these things, we now have from the pandemic, we really have a heightened awareness of health and behavior needs. Like I said before, because of the lack of socialization, we were all we weren't working remotely. Students were learning remotely, but some of our staff were working remotely too. And the lack of socialization is just unbelievable. Prior to that, we're in kindergarten, we're talking about how we work together and we might hold hands. And then all of a sudden when the pandemic comes, it's like, okay, you can't get within 6 feet of anyone. So it's like we undid everything we had taught before. So socialization, we know, is key for us to move forward. So we're working on that. We also had a lot of our students that were developmentally delayed because they were home and didn't have that interaction on a daily basis and maybe not in the best environment at times. So we provided a summer enrichment program the first complete year after the pandemic started. And that whole goal was to provide our students with a lot of hands-on lessons to assist with the socialization, to bring them back. We said, look, we're not having any Chromebooks. We're going to teach everything through hands-on lessons, purchase materials for these students so they can go home and work on these lessons with their parents. We had like really cool sessions for them. It was almost like a conference, and the students could sign up for which sessions they wanted. It was like outdoors fishing and things, and they would take that and teach some math and science to that. So it was really hands-on and nice for our students, and they could continue to learn those skills at home with their parents. So we were thankful for the federal funds that came through. Those funds were there to protect and prevent and respond for the pandemic, but we're looking at, regardless, what can we do to keep our students moving forward? And so the other piece of that too, when we look at socialization and the awareness of health and behavior needs, I have on here like meth/fentanyl. We have more drug use now, and some of that I think is just dealing with and not being able to deal with the pandemic. We know most people react out of fear or lack of control, and I think the pandemic brought both of those to the forefront for people. And then the other thing, when you think about our students dealing with meth and fentanyl and things like that, and the reason I list these are two of the newer drugs that we're dealing with, but our students are coming to school with some very bizarre behavior. We're experiencing some of the things that our school psychs or doctors have not experienced before. And when you think about like fetal alcohol, our staff have been trained on how to deal with that. There's not enough research there yet on meth and the use of fentanyl. And so some of these bizarre behaviors, it just appears that it might be something that we don't have enough information on yet, because they're just bizarre behaviors that might just show up. And we're not used to that. And that's not just here. We're hearing that. I'm hearing that from my colleagues across the state. So I think there has to be more research on that and funding to deal with our students who have been exposed to meth and fentanyl, because we're seeing those behaviors within the school. The other thing I would like to point out on this slide is, like I said before, regardless of the funding sources, our commitment remains on meeting the needs of our students who are our customers, and that can't happen. We know we're not fully funded from the state level. So then our community has been wonderful with partnerships. So it goes back to the strong, powerful partnerships we have with our communities, and also our staff being willing to work above and beyond to write grants to provide the services we need. So this second bullet here is about the state preschool partnership grant that our DOS wrote here. And we're very excited about that because that provided money for two and a half years, a total of $750,000. So we receive $150,000 per semester to serve our Union County preschool, in addition to our Audubon area Head Start. And then the partnership we have is with our Superior Childcare. So this is a local daycare here that we have been able to partner with, and we provide reading and math interventionists not only to our preschool and Head Start, but also to that childcare. So when you think about development delayed students coming in, we're working toward reducing that number. But through this partnership, we have seen a reduction in discipline referrals from our students this year. Attendance has increased from the students that are a part of this grant. And then our academic outcomes, we know are going to be better because we've been able to hire reading and math interventionists for all those areas. And also we're offering PD because we can use these dollars for professional development for all the agencies, not just our own, such as Early Childhood Council. We've sent the members of that to our early childhood conferences. So they've had lots of different sessions based on what the specific current needs are today after the COVID has hit our schools. So that has been nice to have that, the additional dollars there. But again, that's a grant that we wrote and we're accepted on that. So we're very excited about that one. The next one that I want to bring to your attention is the state school-based mental health grant. And these services were available during COVID, and we partnered with the local agency here. And it was really good for our staff too, because we know that our staff were dealing with issues too from COVID. There's a lot of mental health issues, and we're trying to remove that stigma. So we have to face it. There is a stigma with mental health, but it shouldn't be. And so we wanted to provide that service during the day and also at this agency's office. So they were able to go to actual clinic if they wanted to receive those services, or receive services during the school day. And that was all free to them from this grant. So we were very thankful for that. And a lot of our staff and students took advantage of that program. So we're thankful to have that partnership. The next partnership is called our Mountain Comprehensive Care, and that provides behavioral health services through our school-based therapy counseling services. And the nice piece of this is they will provide the services regardless if they meet income eligibility or not. So a lot of service in the past is you had to meet this income eligibility, but we had those students who were right there on the bubble, but they still needed the services. So this was a great partnership for us to be able to provide those services when we partnered with Mountain Comp Care. We know, just as we know the importance of early literacy and numeracy, we talked about before with preschool, we know the importance of embedding social emotional learning within our instructional day. So we have our preschool through 8th grade use a program with Second Steps and Slumberkins. And then our high school, we were able to write another grant through Botman. It's life skills training. Our high school students receive social reinforcement and behavior work through their PE classes. And so we thread our social emotional learning throughout the day in all academic spaces. And we really are working hard this year on bringing that to the forefront as part of our core instruction. It's in our athletics and lots of other programs too. So that's one of the pieces that we want to continue to work on. And as educators, we realize and acknowledge the importance of social emotional development. And we know we have to address the empathy, the physical well-being, and a growth mindset, which are all essential to one's self-worth and academic achievement. The social emotional must be addressed outside the classroom too. We know we can't just take care of this inside the classroom. You know, we only have the students for a few hours a day. Most of their time is spent at home, in their homes or in their neighborhoods. And so we have to address the social emotional learning outside. This is why we have to bring our community involved and get them involved in helping us too, because our parents are our very first teachers, and the environment we learn in is essential. And sometimes we see some of this social media and online bullying starting at home or in the neighborhood. So we need the neighbors to help take care of those issues too. Another factor that plays a significant role in education, we talk about meeting the basic needs of our students, is our district. We apply for the community eligibility provision, which provides free breakfast and lunch to all students, regardless of their income. And because we know that adequate nutrition and hunger impacts the ability to learn. So we've kept our parents informed throughout the pandemic of the availability of extra funds on their PEBT card. And the last payment, I think, was $391 as recent as of September 21st of this year. So we always inform our parents of, check your PEBT card, because if you already have one, those funds automatically go into your card. If not, you can apply for the card, and then through the community eligibility and the federal grants, you'll be receiving those throughout the pandemic. So that helped our parents too. Another partnership we have, we are very blessed in a small rural district with a supportive community. We have two programs here that are operating in our community. One's called Happy Packs, and this is where we have a committee that comes together and they provide free meals for our students on the weekends. So they pack those up and send those home with our students on Friday. In addition to the meals that we provided during Christmas and things like that through the pandemic, we also provided food each and every day. Now, those were definitely our heroes, our food service workers during the pandemic, because they were here regardless of the threat of the virus. And then Happy Feet, that is a program that provides shoes, brand new shoes to all of our students that might need those shoes within our school system too, from kindergarten, or actually preschool, all the way through high school. So those are other partnerships we're very thankful for. School safety, like I said before, that is a shortage of officers and unfunded training. I've already discussed that before. And then another grant we just currently became part of is a grant to continue to educate our students about the risk associated with using nicotine delivery systems like e-cigs. I know everyone's heard about the e-cigs and the increase in vapes within the schools and the smokeless tobacco. But the addictive level is significant with the vapes. So we're very concerned about that. So we're thankful we can be part of that grant. And again, those are all things I've talked about, more of the health and mental health and behavioral health of our students. But when you look at the education side, one of the most powerful partnerships we have is with our local Job Corps Center. It's called the Earl C. Clemens Job Corps Academy. And we partner with them, and we think of this as kind of a free community college for our students, because we really want to focus on post-secondary affordability when you're in a small rural district. Again, the need of our students is very high. And so when we partnered with them, this was our avenue of providing not only a high school diploma, but our students are also able to receive an industry certification, and they transition our students into job placement. So they provide the job placement for them. The cool part about the Job Corps Center is we have a high school that we've placed on the Job Corps Center. And so they receive their high school diploma there, but while they're there getting their industry certification, they also receive a check every 2 weeks. And so the cool part of that is they can take those funds that they receive from the Job Corps Center and put that in an account. And so when they finish their degree there and their certification, they have a small pot of money, anywhere from $2,000 to $4,000, depending on how long they stay there. And if they work on an advanced degree, to have income in their bank account for that first small car or the first payment for rent or something like that. So not only do they walk out with more certifications in their hand, they have money available to them to begin living life independently. So we're very thankful for that. And they provide a plethora of certifications. And so we have a locally operated vocational school here with several certifications available, but there are so many more that the Job Corps can offer, like advanced welding, and they look at cybersecurity and things like that. So there's a lot of advanced degrees that our students can receive there. And the cool piece of that, not only the funding that they receive, is when they come out of those programs and those advanced programs, our students that graduate with welding certifications, they begin around $70,000. That's almost double what our certified teachers who have a bachelor's degree is making, and they don't have that loan like a teacher might have. So again, it's $0 for them, but I think Collin had talked about, there's no silver bullets when you talk about anything, making sure that one thing is successful, no matter what the program is or what agency is. The only silver bullet that I can think of, Collin, is when we talk about it in public education, it's about relationships. So when you develop those genuine relationships, whether it's with students or our community partners, that's where the powerful partnerships come into play. And we contribute most of our success in a small rural district to our community partners and also our staff that are willing to go above and beyond, put that extra time in to write those grants. Because like I said before, the federal funding we've had during the pandemic was to protect and prevent and respond for the pandemic. But the issues we have today and have had in the past still remain, and they're going to remain after the 2024 funding is gone. So a lot of the federal funding will be gone in 2024, but the issues remain for us to deal with. So if you go
Patricia, I'm sorry, we're just about out of time here, but I think what we've clearly heard from Patricia is that when you have strong leaders in a school district, the problems don't go away, even if the funding does, and you find creative ways to address those, including with strong community partnerships. Ashley, I'm wondering if you, by the way, we've had our questions have been answered directly with type. So fortunately, even though we're constrained for time, I think we've addressed those. But Ashley, I wonder if you could reflect for us. I'm imagining that if I wanted to run for the state legislature, I probably couldn't have a platform that says, and I'm going to raise your taxes. And my opponent who said, no, I'm going to cut them, just might beat me in that race. But on a more practical level, we have people from around the state who have listened today and would like to be advocates for the investment in public education. And we talk a lot in the foundation about creating an army of advocates. So if I'm knocking on the door of my state legislator or talking at asking a question at a candidates forum, how can I frame this that this need exists and that I think that the public should invest in it?
Thanks for your question, Mark. And, I think there are a lot of ways to answer it. The first one thing that's coming to mind for me is really, this framing in terms of the health implications, I think is really important. I think that Kentuckians care about education, they care about kids, and they understand that the state needs to make certain investments in order to have healthy communities. And we actually wrote a report in 2019. That's what's really coming to mind right now, called critical investments in a healthier Kentucky. And went go through the different the social determinants of health that you all are focusing on today, and the critical piece of investing in education, K through 12, post-secondary, that we need to do that as a state if we want to have healthy communities. So I hope that framing is helpful, and we absolutely need to invest more in education, as we've been hearing and talking about today. So.
Thank you. And I just remind everybody that I hope that what you've heard today will help you frame that argument when you meet with state officials or would-be state officials. It's the campaign season, so it's a chance to ask what investment I can expect from you, candidate. So thanks, panelists, for being with us and for the depth of your knowledge and what you've given to us. And we're going to take a short break, and back at 11:30, I think. I'm going to check my time frame real quick.
We're actually going to roll right into the next session. So
oh, right. Okay.
when this panel ends, we will begin the keynote. And I want to thank all of our panelists and Mark Neikirk for joining us today. All the presentations are exceptional. Thank you.